This is my presentation on maple syrup urine disease for biochemistry. Maple syrup urine disease is a rare genetic disorder that typically presents in the neonatal stage of life, and it presents with the key characteristic of the inability to metabolize certain amino acids. And due to this inability to metabolize these amino acids, it leads to the accumulation of toxic substances, which are organic acids that are produced by these amino acids. So there are a handful of genes that are affected by this, but ultimately these genes affect the ability for the BCKAD enzyme complex to really exist and to properly do its job. So the key clinical characteristics of MSUD to keep in mind as we go through this presentation are as follows. There is the maple syrup odor in the semen 12 hours post-birth, which is just what really is the key characteristic and hence the name of maple syrup urine disorder. But not only is it keyly in the semen, which is the earwax, but it can also present in sweat and urine within an infant with MSUD. Following that, there is irritability, ketonuria, and poor feeding that happens from 2 to 3 days of age. And if not treated at this point, we start to see the disruptance of the central nervous system. That is also a key characteristic of this disease. As a worsening course of encephalopathy happens with apnea, opisthotonosis, and lethargy. Furthermore, there are some odd central nervous system movements that happen, such as fencing and bicycling, that can also develop. And this is pretty quickly onset. This is 4 to 5 days of age post-birth if a child has MSUD. Unfortunately, if the child continues to deteriorate and the central nervous system is continuing to be affected, a coma and respiratory failure can happen at about 7 to 10 days after birth and ultimately leads to death. Thankfully, there are also milder cases of MSUD that are livable and treatable. MSUD itself is completely treatable, but if a milder case happens, the child mainly only presents with anorexia, stunted growth, and delayed milestones. Biochemically speaking, there's a lot that happens right here, especially because MSUD impacts such an important part of the metabolism cycle. It is specifically part of the urea cycle metabolism and specifically with amino acid metabolism. So it is incredibly important to understand where exactly the biochemical functions of MSUD are affected, as well as what a normal biochemical function with somebody without MSUD also looks like. So taking a look at normal biochemical functions for a second, when someone intakes a lot of proteins such as fish, cheese, eggs, or meat, or they also are breaking down proteins from their muscles, they become amino acids. And specifically, MSUD happens to affect branch chain amino acids, and this includes leucine, isoleucine, and valine. From here, the BCKADs go into the mitochondrial inner membrane where the enzymes break them down and there are released as energy and growth and nutrients. If here's a more of an inside view of that, so as we have here, we see that there is leucine, isoleucine, and valine, and they are brought into the branch chain aminotransferase, which is that BCKD enzyme. And from there, they are put in and then further brought into their CoAs to become what they will end up going into the TCA cycle as. However, if you're somebody with MSUD, the problem begins at the BCKAD enzyme site. Because the first step of amino acid catabolism is a commitment step, this causes a buildup of BCAAs and their toxic subunits. Those organic acids that I mentioned earlier specifically are alpha ketoisocaproic acid, alpha keto beta methylvaleric acid, and alpha ketoisovaleric acid. And these will build up in the plasma of the blood because they are unable to be properly disposed of, while the amino acids themselves become the main ketonuria components that were presented as a key characteristic of the disease. While MSUD itself is a rare genetic disorder, there are testing and treatments that have already been made to prevent the complications of MSUD. So, especially in populations that are high in Mennonites or Ashkenazi Jews that seem to have a higher chance of having MSUD, there is a commonplace test put forth within the United States that is just a heel prick once a child is born. And from there, they're able to test for ketonuria, which, as mentioned earlier, is a key characteristic for maple syrup urine disease. From there, if your child does have maple syrup urine disorder, treatment can begin very, very early. So, what you want to do is the main part of the treatment is dietary management. So, while a lot of people tend to have a really high protein diet, for MSUD, you actually want to lower it as much as possible. So that means cutting out eggs, that means cutting out fish, meat, whatever you can that has a high protein count in it. That even means if your child is still on formula, adjusting to special formula so that your baby is still getting all the nutrients that they need, but not causing a risk of acute metabolic attack in the same way. So this leads into the question of, well, proteins are very, very important. They're very, very important to what we do for everything that the body does, which is where supplementation comes in. People are able to take supplements of isoleucine and valine to replace any essential amino acids that are lost due to a low protein diet. And from there, a regular monitoring of blood levels and of blood amino acid levels is done to prevent any risk of acute metabolic attack. So even though MSUD can be treated early, if there is an inability to maintain a low protein diet, those blood levels can go back up and cause an acute metabolic attack, which causes further complications, furthering the complications that can be done to the central nervous system and to other parts of the body and parts of the urea cycle. However, a more permanent treatment that seems to be coming out, or at least a long-term treatment that's being brought out, is liver transplants, which is really interesting. So what people can do is if they have MSUD and they're looking for a long-term solution to preventing these acute metabolic attacks, they can be eligible for getting a new liver, and especially a liver that does not have this problem with metabolic attacks. And so while it doesn't completely remove the risk, it doesn't remove MSUD, it does make these people more in the process of preventing and possibly not even having these acute metabolic attacks that come from MSUD. It's still a new thing that's being developed. There is also some gene therapy that is being developed, but nothing in totality has become the main process. And that is the end of my presentation. If you have any questions, let me know. You guys have my email. And yeah, this was maple syrup urine disease.